Hi, I am Dr. Shashidhar Karpurmath, Consultant Medical Oncologist, VSH Hospital, Bangalore. Events like Cancer Day definitely help us in creating awareness in the community because cancer is a deadly word and people do not want to discuss about cancer. So, on events like World Cancer Day, people open up and in fact we have a chance to interact with them to raise the awareness. Yes, I think the most important part of detecting a cancer early and helping us to prevent cancer is awareness of the public that these are the things which can be done. So definitely I feel the most important part here is public awareness regarding early detection and prevention. It definitely plays a role. So as we all know, like every day we see advances and progress in all the walks of our life. The same holds good for oncology also. In fact, the treatment of cancer has undergone a dramatic change from what it was 10-15 years back to what it is now. So to quote an example, like the type of chemotherapies we use, the availability of supportive care medicines, availability of blood components, we have availability of various infrastructure for conducting major surgeries, radiation machines have improved with respect to the delivery of radiation, and transplant units with lesser mortality rates. So these all things are available in the present day scenario. So obviously the number of people who are cured of cancer has increased. The number of people who suffer side effects or who are affected by side effects have come down, and drastically the numbers of people who are getting cured and returning back to normal life has increased. So obviously whatever advancement has happened in the field of oncology has transformed the outcomes of cancer treatment in the population. Most of the people will have this question like what role I play or what can I do to reduce the risk of cancer. So we all know it all boils down to again knowing what is the cause of cancer. So suppose obesity. Yes, the question asked is here is obesity, does it lead to cancer? Obesity means overweight. So overweight people or obese people are prone for colon cancers. So by reducing obesity, the risk of a person getting a colon cancer can be reduced. So obviously lifestyle changes have to be made, like we have to lead a very active life, we should avoid sedentary lifestyle, we should have good nutritional food. And regarding diet changes, I think there are few things like avoidance or decreasing the consumption of red meat, which again, like red meat has been proposed to be a major risk factor for development of colon cancer. So avoidance of red meat contributes to reduction in colon cancer. In addition to that, we also can develop a healthy lifestyle, stress-free life, good nutritional diet, and have awareness about cancer so that we can all achieve this goal of avoiding cancer or reducing cancer incidence. Obviously each cancer is different. In fact, each cancer in two individuals will not behave similarly. So there is something called as solid malignancies and hematological malignancies. So solid malignancies means the cancer which affects the organs like lung, throat, stomach, pancreas. So hematological malignancies means these are the ones like blood cancer or lymphomas, myelomas. So each cancer like hematological malignancies, they behave differently, solid malignancies, they behave differently. So all cancers have to be approached in a different perspective. Pediatric cancer, that is the cancer in children, is definitely a different ball game as compared to cancers in the adults. So the good news here is that most of the cancers in children are curable. So more than 90% of the cancers which happen in children can be cured. Even though the cancers in children, they are very aggressive, but at the same time they are more susceptible or sensitive to chemotherapy. The side effects on the contrary, children tolerate chemotherapy better than adults. So pediatric cancers, the biology itself is different. They have a good biology and most of them are curable. We at VSH have a very good team of oncology and also support staff. which includes other departments which also help us in our treatment and also for the detection of cancer. We have a dedicated chemotherapy daycare unit at VSH. We have a dedicated OT. We have all the facilities which will help the oncosurgeons and medical oncologists like us to give proper treatment to people. And we have a very dedicated support staff like nursing staff who are well trained and who are compassionate enough to take good care of you. Thank you.